we have an opportunity to respond in a way. And that opportunity does bring me some hope because I think we have an opportunity to react and respond in a way that makes us better and that makes the people around us better. So, if anything, sometimes adverse circumstances just make you rise up to the challenge. And that's what I'm going to try to do personally. And I'm hoping other people out there, and especially in the healthcare world, join us as well. It's too important. It's too important not to lean in.
The Collaborative Family Healthcare Association. I am the production editor, Grace Pratt, and I'm joined by three of my co-hosts this morning for our first podcast of 2025. It's a new year. I feel like a year that I'm not quite sure what to expect from. Many of us probably are feeling that way, feeling some changes coming, but not knowing what they'll be or how we'll be affected. And so we're going to talk about that today. We're going to talk about moving forward in times of uncertainty. We're going to talk about what's happening, in 2025 in the landscape of integrated care as far as we know it, and just spend a little time together as we're kicking off our year. For our icebreaker question, I have a poem that one of my friends shared earlier this week. The poet's name is Lauren Brantz, and the title of the poem is Inauguration 2025. And the poem says, "In a time of hate, love is an act of resistance. In a time of fear, faith is an act of resistance. In a time of misinformation, education is an act of resistance. In a time of poor leadership, community is an act of resistance. In a time like this, joy is an act of resistance. Resist, resist, resist." That resonated with me a lot, and it had me thinking that maybe as we're starting off this morning, we could share, because I even without all of the things that are happening, January always feels like a little dark time to me. It's literally dark, it's cold, the holidays are over. And so I've been talking to my kids a lot about being like a joy detective and a positivity detective and looking for light. So I'm curious to hear from you. Where are you finding bits of joy in these last few weeks? So going around the circle, from my perspective, first we have Neftali Serrano.
Hey, everybody. I'm Neftali Serrano. I'm the CEO here at the Collaborative Family Healthcare Association. And I love your question today, Grace, because yes, I think joy and engaging community is the answer. And so that's where I've been finding things. I don't want to just sort of give in to sort of feeling disheveled and lost. And when I feel that way, the things that ground me are the people that remind me of goodness in the world. And this is going to sound totally self-serving here, but it's 1,000% true. One of the things that I've been reflecting on and my role is just how awesome it is to have this community. And I realize that I take this community for granted. When I say this community, I'm talking about CFHA. I've had this community since 2005. And I realize I take it for granted that this is a community I can come back to that shares certain core values about life, positivity about healthcare that frankly doesn't exist in a lot of other places, positivity about what we could do to care for people in teams, and frankly, just people who just share an openness and a humility to think differently about their professions and a service attitude really to their colleagues. And like, that's special, right? I mean, that's like really, really special. And I realize I'm so lucky to have a community that I belong to, that I can go back to, that does that for me, And so I've just been, especially over the last couple of weeks, just trying to think about like, well, how do I dig deeper into my community? Because that's the place where I can make change. And that's where I can live out the values that remind me of who I am, even if I don't think the world is exactly the way I am. So yeah, I think that's where I find those moments of joy. And by the way, I love it. This is such a great mom strategy. What is it? Joy detective? I'm going to use that one. I love that.
Yeah, we're big into spies and detectives and ninjas in my house. So you just got to put it together, you know.
Joy Ninja is pretty good too. Yeah.
Me too. Thank you, Neftali. Next, we
Mm.
have Jen Thomas.
Yay. Hi, everybody. Jen Thomas, Family Med, Addiction Med in Morris, Illinois. Yeah, so I love the poem and it really resonated. And I think I needed it Monday because it wasn't so pretty at my house. It was pretty bleak. It was like I have two teenagers and a junior high kid. They were just coming off of this TikTok death and resurrection over the weekend. We're like, oh my God, the world's ending. We don't have TikTok. And then it came back. So a lot of ups and downs and feelings in my house. So there may have been ice cream and French fries to cope on Monday with all the things. That's not usually our norm. And that's okay. I think from time to time, you have to kind of just, all right, what feels right today in the moment of uncertainty and a little self-soothing and having, not taking yourself too seriously. But yeah, finding the joy, 100%. I echo that and feel that. So the community of CFHA, right? All these times of uncertainty, it's like, this is the group that gives me faith in humanity. And like, it's amazing knowing that you guys are out here, smart people that we can, connect and talk, and even in uncertain, scary times. So 100%. It was right before the pandemic, like 2019, I got pretty involved. And I've said this before, but that was one of my saving graces through the early pandemic. It was like, I remember driving to work, and everybody was on lockdown and like listening to podcast episodes. And like, well, this is a group of smart people. They're engaged. They get it. They're not afraid to talk about feelings like some medical people kind of shy away from. So absolutely, this community is a saving grace, and it always helps me to reconnect in those times of uncertainty. So
Somebody's got to give an answer other than CFHA because it's going to sound really bad.
Oh, you're deep.
I stole Neftali's answer. I did, but it is still true.
Well, next we have Bridgette D.
Yeah, my name is Bridgette. I'm Director of Primary Care Behavioral Health out in Washington State and an FQHC, BHC, consultant, lots of different things, lots of different hats. And, back to what you were saying about being a joy detector, I think it's important to be a joy engineer. And so a big part of what Dave and I do is just bringing intentionality to our everyday lives. And so, when you asked that question about joy, I just kind of started writing them down, and I realized how much I've engineered that to be the case. So, I know it's silly, but I'm never going to miss an opportunity to not talk about my bearded dragon, little Red Boo. She's brings so much joy. Dave and I have been doing these basketball workouts. We rent out a little gym, this little local gym, and we will play on the weekends doing like drills and shooting drills and stuff. I know it probably doesn't sound fun for other people, but we blast the music and we do our workout, music, hikes, reading, learning. And then my personal favorite is deep conversation. I like to just, take a conversation and see where it goes. And those little aha moments of seeing something in a different way, I think brings a lot of joy.
I love that. Thank you for sharing that. And then
That's awesome.
I am Grace Pratt. I am the behavioral medicine faculty at Integris Great Plains Family Medicine Residency Program in Oklahoma City, Oklahoma. And we had a triplet 8-year-old birthday party last weekend. And we have a giant balloon, like banner thing in my living room left over from the birthday party. I don't know. Well, for my colleagues here, I'll show them on camera at least.
Oh, I love it.
There you
And it's
go.
bright colors, and it's like
Awesome.
blue, teal, and purple, and matches the rest of the art in my house, and it's just making me so happy. And it's staying up. The birthday party is done.
Save it.
Thank
Save it.
goodness. But the joy of the balloons persists. So that's bringing a lot of brightness and light to our house right now. Well, thank you all for sharing those things and sharing your moments of joy. And we could go on. I think about love and faith and community and how we're finding those things. And I think that is going to be a part of our conversation as we move forward, talking about how we're navigating uncertainty and how you keep going in an uncertain time. But before we get to that main topic conversation, Neftali, do we have any news and notes?
Yeah. So, some of you who are listening to this, if you're watching on YouTube, hello, you saw Grace's balloons. And if you're just listening to this, you might be listening to this around the time that our call for proposals opens for our fall conference, which is in February. So yeah, if you geek out about the stuff that we talk about, if you love teens, if you love primary care, if you love specialty care, if you are into integrating physical and behavioral health and you want to learn more about this community, the fall conference is a great place to do that in person. This year, our conference is in Raleigh, North Carolina, not too far from where I am here in Chapel Hill, North Carolina. It's going to be absolutely awesome. It's going to be a great opportunity for folks to display what they're doing at their clinics, new innovations, new strategies. So yeah, make sure the best way to come is to present. Over half of our attendees are actually presenters. So come, bring your thoughts, bring your ideas. So get your teams together and submit those proposals. I believe the call for proposals ends, I think it's mid-March. So you have a little bit of time to get your ideas together and submit them. For more information, you can always go to integratedcareconference.com. That's integratedcareconference.com. There you will also soon see information about a spring event. We're not going to have like a spring conference this year. What we decided to do was more do a deep dive and say, what do we need to kind of tackle as a big problem? And one of the biggest problems we could identify is pediatric mental health. There's just so much need in that area. And we thought our community needs to upskill to meet this. We can't, and this is a very PCBH attitude, we can't be like, oh, I only do X, right? I only do adults. For your primary care, you do everything, right? So PEDS is part of that. So we want to upskill the community in pediatric intervention skills. We've got a great group of CFHA members who are leading this. They are designing it, they're leading it. This is not coming from staff, this is coming from CFHA members who are saying, we're passionate about this, got some skills. So they are going to be leading this masterclass. We're calling it a pediatrics masterclass event. So again, for more information, check that out. Also integratedcareconference.com. And that's all for news and notes.
I'm having a whole lot of trouble unmuting myself today.
It's January.
We're going to lean into the awkward pauses. It's fine.
Yeah. It's the cold weather. I think things move slower technology-wise, including us in the cold.
Yeah. I know that I personally move slower, so
Same.
you can blame it on that. Well, thinking about our main topic this week, Neftali, you broached, this was your show topic idea. And so I wonder if you could tell us a little bit about what you were thinking. What leading did you feel towards this idea?
Well, it's exactly your intro. I've been doing a lot of thinking about what it means to be a healthcare provider in these next 4 years, because there's literally going to be a lot of things coming our way as citizens in the United States, but also just a healthcare provider, because leadership and administration at the highest levels of healthcare is changing. And so what does that mean, right? And again, those feelings of feeling disconcerted and like, what is HHS going to do differently? What priorities are they going to have? They're going to shift away from primary care, shift away from preventative care, shift away from public health. Is integrated care and the idea of integrated care going to be impacted? So in that context, I just started thinking about this community. And then Chus Rojo, who is our blog post editor, put up this post by Dan Mullen. It's about Dan Mullen, who is one of our CFHA board members and longtime CFHA member, and the work that they're doing in Massachusetts. And it just reminded me, hey, wait a second, like we still have a lot to say here. There's lots of opportunities we have here for growth. And Bridgette, you actually did a really good job, I think, prior to the start of the podcast, giving a summary. I wonder if you can cue up a little bit of a quick summary of that, because it basically outlines like, hey, Massachusetts is at least thinking about some innovations in the space of creating a different way for paying for primary care that recognizes the team-based nature of primary care, and that paying for the work of the team and the value it provides makes a lot more sense, right? So, Bridgette, you want to cue up some of that you were talking about?
Yeah, basically, the return on investment for every dollar that is invested into primary care is just really great. So, but if you look at our spending, a small percentage of the spending actually goes into primary care. So it looks like in Massachusetts, they're trying to increase that sliver to a slightly bigger sliver of the spending and to be able to invest in primary care. And I think the thought process is that if they can get more monies delegated, then it incentivizes probably the workforce and incentivizes research into it, which you would imagine would further prove the really good return on investment. And I know that when we had our CFHA, oh gosh, I think it was 2020 and even 2021, we had some folks from the Robert Graham Center come and talk with us. And it's like, once again, the outcomes for every dollar that is invested in primary care just is so much more efficient than investing in other aspects of healthcare. So I think that's the idea, is to get more funding and to actually invest in that infrastructure and get folks on the same team, rowing in the same direction, instead of it being completely split apart and saying, okay, behavioral health, you're going to route up this way, and physicians are going to route up this way. It's like, no, we're going to invest in that primary care team where they're all rowing in the same direction.
Yeah, and the specifics of that sort of effort for this year is that Massachusetts has kind of authorized this group to study a per member per month payment. So instead of being paid by the visit, which we all know in primary care is like a ridiculous way of, paying for our services, basically clinics are going to be eligible. Well, they're going to study how they can make this work, but they'll be eligible to have a per member per month payment for each member that they home in their primary care home, which means that then you don't have to worry about, like, and they mentioned this specifically in the post, paying for every pharmacist and pharmacist visit, right? Which I love pharmacists. I'm so glad they mentioned pharmacists. Like, we need pharmacists on the team, right? I mean, it's so awesome. When you work with a pharmacist, you don't want to go back to not working with a pharmacist. Same thing with the behavioral health profession. You have to worry about the fee for service thing. You just get sort of a lump sum payment for that. And so the bill is really looking at creating a group to study that specifically. So I think there's these pockets of, like, hey, yeah, dig in. Like, there's ways you can make things work. And then, not coincidentally, because this is something I expect of her at this point, but Jen Thomas, here with us today, emails me, I think it was last week, I don't know, but Jen, you emailed me about some work that the Illinois Psychiatric
Society.
Yeah. And I'm like, oh man, so this is another area we could dig in. So tell me more about that, because that sounds pretty awesome.
Yeah, it is. It's super awesome. And I will share and be very vulnerable and blunt. The blog posts are great. As a frontline PCP, it makes me a little sad though, because I'm like, is this ever going to reach me? Like, am I ever going to get to a place where I feel like the system I'm in can transform, where I'm still in the workforce? Because it's great, but it's hard to keep hope sometimes when you're in the trenches of like fee for service, RVUs. And it's like, I don't know how we'd ever even imagine a different world of existing. I'd love for that to be the case. So coincidentally, the Illinois Psychiatric Society project, I was literally thinking about this last night, is an example of the hope, though, finding the joy. So this is a group of psychiatrists that has been looking to do integrated behavioral health implementation for years. They kind of clung on to the COCM model because they're physicians, and it involves a psychiatrist. So that's kind of the only share the journey of like, there's all different kind of models. There's PCBH, there's blended models, and that's been really eye-opening and fun to explore that growth with them as a group. But it's really exciting because there's this appetite to come together as a community. So there's a real interest now from some of our Illinois state reps to bring some policy work and legislation and some dollars toward expanding access to integrated behavioral health through COCM in Illinois. And the board here, there was a comment just yesterday of like, in my 40 years on the IPS, I've never seen us come together as such a great team. We've got the folks from Woven Clinic, the young psychiatrists out of training that are doing a lot of work with the representatives. We've got people, the exec director that's pulling together board members. I've really enjoyed flexing creative muscles on Canva. I'm like such a geek for that now, of like, hey, here's a cool flyer and it looks pretty, so it's like a one pager, and we've come together as a group, and it just speaks to the whole really neat thing. And I think that is the secret sauce of CFHA. It's the multidisciplinary team. It's the coming together as a group and problem solving for, we think we need to see a change. We need to embrace this model of not just do it the same way psychiatry's always done it. What if we did this team-based approach and really getting to know our colleagues colleagues in primary care. So that's been a real pleasant surprise. I first started going to their meetings. I'm like, I'm not a psychiatrist. I don't know if you're going to kick me out if I even belong in this Zoom room, but they've been so welcoming. And I think we've found our stride as a group because we have all these different perspectives. So yeah, our next hope is to come together with a work group, a statewide work group, to see this move forward. And CFHA is just a really awesome partner to have in that. We have experience doing that, hosting groups nationally and even on the state level. So yeah, that's been really, really positive in this time of uncertainty to see that group come together and say, hey, we've never been so efficient, and we've never seen results coming together like this. So that's really warmed my heart, and gives me hope that, like, hey, there is, despite the negativity of like, it'll never happen in my day, like it might, and we might have to come together and keep working together and not give up. So
I love it. So both of these projects that we're talking about right now are such local projects. They're people on the ground in their communities connecting with who's doing the work around them, and Jen, they may not have been the people that you would feel at first were your people, but then finding them and keeping our eyes open for that commonality and that shared language, even as we have different backgrounds and experiences, is definitely something that gives me a lot of hope. And hearing from other places these stories of moments of success, moments of connection, moments of moving forward is helpful, because it can start to feel, when we're doing this work, like it's closed door after closed door after closed door, or we make a little progress and then it just gets yanked back from under us, or that everything that's happening is so far distant from us and so far out of our control that it can be, I think, sometimes I want to use the words like demoralizing, or, that further than burnout, but into compassion fatigue or into moral injury, to be sitting across the exam room from someone who has so many intense needs, and then to start to feel like, oh, there's just nothing I can do, and to start to feel helpless. But looking for the progress, looking for the places where change is being made, really does help build hope. Because like, you're doing it, and I know you, and we're connected, and if you can do it, maybe I can do it. And I think that's a really big deal.
Yeah, and I think specifically, I would just point out as well that I think one of the areas that I'm encouraging healthcare providers out there to dig into is leadership training, and just getting leadership support in general, because I think that's what we need to embrace when we see that larger systems are maybe not taking the lead, or there's sort of a vacuum of leadership. Even though that's not what we do, you may think of yourself as I'm just a clinician, right? The truth is, we don't have that luxury to just be clinicians. We are all in some way, shape, or form leaders. Leaders on our teams, leaders in our clinics, leaders of programs, leaders of efforts, or at the very least, voices, right? We can be voices for our patients. And we're going to see more and more situations in the exam room that are, as you said, Grace, like demoralizing and can lead to that compassion fatigue. We're going to meet with immigrants who are afraid. We're going to meet with and grieve with folks in the LGBTQ plus community who are anxious and feeling pressured. We're going to see funding shifts that maybe are not things that we know are good for us or our communities. So in light of that, we have to activate our leadership muscle and empower our leadership muscle to connect us into the areas and the levers that we do have some power and say in, because we do have power and say. As healthcare providers, we do have it. It may feel like you don't, but when you compare yourself to the average citizen as a healthcare provider, you do. Grace is a leader in family medicine, and she has the ability to shape resident lives and her fellow faculty, right? Jen is in her system, and as convoluted as her system might be sometimes, she's got a voice in COCM, in that system, and now in the state, right? Bridgette has, together with David, has been doing a great job over the last several years, just training all slew of folks. But you know what? When Bridgette and David train, they're not just training in PCBH skills, they're training many leaders who go out there and change their care teams. right? These mini BHC leaders who go out there and do culture change, because that's a lot of what PCBH implementation is. It's culture change, right? And so like everybody has that opportunity. If you dig into that and identify yourself, say, I'm a leader. So what kind of leader am I? And what are the skills that I need in 2025 to be a better leader? What can I improve upon? I think that's an approach that will keep you grounded, even in those moments where you're really feeling hurt by what you're seeing in that exam room or in your clinic. Sorry, I didn't mean to mic drop on that.
No,
I'm very passionate about it, obviously.
Yeah, letting it marinate for a minute and thinking about, we definitely have to figure out what is our sphere of influence around us and what can we control. And I think as you were describing, part of the pause for me was thinking through the different groups of people that you were talking about that we're going to be sitting with, that we're going to be grieving with, who are scared and uncertain. And I think many of us who are helpers and who have gone into healthcare want to be able to give an answer or give some reassurance or tell people, well, you don't have to be worried about that, or like, here's how to fix that. But a lot of uncertainty can't be fixed. We can't reassure people about things that aren't or are not going to happen because there's so much we don't know. And so to be able to build up in ourselves our ability to have some distress tolerance, to sit with discomfort, to sit with grief and uncertainty, also, I think is an undervalued skill. And it is a skill. It takes practice for us to manage our own dysregulation or our own discomfort with someone else's uncertainty too. And just because we're like, oh, well, you shouldn't be. Sometimes our impulse inside might be, you shouldn't be as worried about this thing that you're worried about, especially if it's someone that we don't have the same lived experience as them. But it becomes even more important then that we don't negate someone's anxiety or negate someone's fear or diagnose this fear and uncertainty as a clinical anxiety disorder. If it's not, we don't want to medicate uncertainty out of someone when they're experiencing, for example, generational trauma or a cultural distress or marginalization or oppression. And so a lot of that becomes listening to the voice of the person who is sitting across from us and managing our own distress around their uncertainty and our inability to help. There were a few other kind of concrete. So you shared 2 posts with us, Neftali, and we'll put the links in the show notes for our listeners. One of them is the one that Bridgette recapped for us about, what's going on in Massachusetts. But the other was a post that you wrote about kind of looking forward into this year and hopes that you have and really a charge for our community. Could you say a little bit more about that?
Sure. So I talked a little bit about one of them, which is leaning into leadership. And I would specifically charge our listeners, leadership doesn't mean you're the boss. Leadership just means, as you said, Grace, identifying your sphere of influence and deciding to lean into getting better at certain skills in that area. And it could just be like, if you're concerned about migrants and how they're feeling and being able to sit with them effectively, guess what? Best thing you could do is learn Spanish. Just learn Spanish in 2025, because your Hispanic patients will love you for just listening to them and being able to relate to them in their own language. That itself would be a therapeutic. That's you being a leader, right? So it's not about, kind of, I need to be the boss or I need to make all these changes. Everybody has that potential. And from CFHA standpoint, it's one of the things we're thinking about. How can we help provide skill development, leadership training, leadership opportunities for folks in the community? Because that's going to be essential for surviving the next few years. Not just surviving, I hate that word, but you know what I mean. The other 2 things that I think are really important, one is just simply being able to measure and capture what we're doing. I think we've avoided it for far too long, and we've had good reasons for avoiding it, frankly. A lot of it's because we're not supported to do measurement the way our primary care colleagues are. When I say we, in this case, I'm talking about behavioral health professionals. It's not part of our culture, and it's not supported technologically or monetarily. For physicians and other medical staff, it is. You have lab results, you have EHRs that support it. The whole system supports measurement in a very easy way. And there are very doable ways that do not interrupt a 15-minute visit with a patient to accomplish measurement if it's just simply well supported and if we have clinicians that are trained to do it. And I think that is going to be absolutely essential because we have lots of stories of how awesome integrated care is. We need to match those stories with data. And there's lots of ways to chop that up. So there's lots of ways to do measurement. There's not just one way, but we need to lean into that. I think some leaders in this are actually on this call today. Bridgette and her clinic out in Washington are constantly reporting on their metrics, constantly talking about the hard data. And what that does is it says, yeah, this is a clinic that provides high quality care, right? It's like incontrovertible, their story at Yakima. So we need more clinics following their lead. One of my frustrations has been like, David and Bridget are the only people who post that thing. When I was the director of behavioral health at Access Community Health Centers in Wisconsin, I used to post that as well. But I didn't post just like David and Bridget. I didn't post to brag. I actually posted because I wanted other people to match. Like, just you post too. Like, let us know what's going on to your clinic. We need more of that. We just need more of that in the space. And then the other thing that I wrote about was just, we're going to need folks who are leaning into a future of payment and a future of kind of thinking about primary care that is very, very different. So we've got to put those building blocks in now. And so that's where the Massachusetts thing is so helpful, right? Where we start thinking about teams and we start thinking about payment very, very differently. And so we've got some great work groups that are going to be putting out some really significant position papers and recommendations. Our measurement-based care work group is going to be putting out position paper or position statement on measurement-based care. And then our value-based care work group is going to come out. And this is like in the next probably 6 weeks, no, probably 4 weeks, on sort of where we are with value-based payment and integrated care role in value-based payment specifically. There's been a lot over the years on value-based payment and a lot of sort of vague language around how integrated care is good for it. But we need to get to brass tacks. We need to get to the place where we're actually specifically saying X is the way to go. Let's go this direction. This is what we need to do. So I think those are the things that to me are going to be really important for us to lean into this year.
There are things, Bridget and Jen, that you're hoping for this year or that you're moving through kind of personally in your roles, in addition to what you've already talked to about of how you're moving through uncertainty.
Go ahead, Jen.
Yeah, I guess what's resonating with me is just the defining the leader. I historically didn't think of myself as a leader. Physician hierarchy. I think it's like, oh, the leader's the CMO, the leader's the CEO, whatever, department chair. But it's been really neat to just sort of redefine that and read and learn from folks like you guys. Like, oh, the leader is just someone who creates, change and helps others to also lead, to get involved and not be the boss and tell them what to do. It's, helping pull in this direction. And that's been a really neat thing to think about through a physician lens. So trying to apply that in whatever that shape or form looks like in 2025, I guess, for me.
Yeah, I mean, I go back to what you all were saying about the sphere of influence, as well as what Neftali was saying about expanding your skill set. So those two things resonate very strongly. I'm constantly looking at and saying, okay, at my organization, what can I influence? At the state level, what can I influence? Nationally, what can I influence? And one of those things that was becoming very apparent was being able to do more coursework. So we have our PCBH lab, and this isn't some like, we're already sold out for it. So it's not like a weird plug, like, oh, sign up today. Although, if you wanted to sign up for lab 4, that's fine in the fall. But we're sold out for a 3rd straight lab for PCBH implementation. And then additionally, Dave and I are creating a PCBH blueprint that will be on the horizon. So look out for that regarding skill sets for BHCs, with the whole idea of how can we help upskill folks to be able to go do the work, to what Neftali's point was earlier. And that's a huge part of Dave and I's consulting work, is just looking and seeing what the needs are, and then what skill set and what do I have in my sphere to be able to contribute, to that, and pushing ourselves with our content to try to address some of the problems, especially problems that you kind of see a pattern to. You know, you talk to an organization, they come up with these concerns. You talk to another organization, and Dave and I are constantly looking for patterns of problems and saying, hey, do we have something that exists that can address that? And sometimes we might already have it in some of our content, but maybe we haven't made it clear enough. So that's another thing that we're constantly trying to do is how can we make our material and our content more digestible? So that's another huge push. And then doing playlists. I just went through and organized all of our demos, snippets, corners, and then I just made a catalog of our 95 PCBH corners, all based on topic. So I'm going to be sharing some of this stuff with folks to be able to try to have easier access and better organize to get the skill sets that are necessary.
That's awesome.
Yeah. I should mention too, for those medical champions out there, I know you're out there. You may have found us on the podcast or wherever. Get engaged. That's one thing Laura and I as medical directors are really trying to beef up this year, is a place for us to gather and share the highs and lows and what's helped to be that champion of change when you're the busy clinician, because it ain't easy to make time or space or have a voice if you're doing the primary care work. But we're pulling that together. Our first meeting's February 7th. So come one, come all.
You know, that also reminds me of another joy detector thing. Jen, you probably know this. There's a thing, I know my wife is an ER physician. She listens to this sort of like CE training thing called EM Wrap all the time. And there's a primary care version of it.
Nice.
I forget what it's called. I should know this. But anyway, there's a primary care version of it for physicians that, you know, you get CE while you listen to stuff, and they're short, like 15-minute type things. And so I'm doing a series of them on integrated care. It's their first series on integrated care with a physician here at the University of North Carolina who is part of that whole thing. So that's another cool thing that, like, we're starting to reach medical champions in different spots. So
yep. Need it to be accessible, right? Listen while you're folding laundry or driving to work. You can do it. Good.
Last thoughts for you, Neftali?
No, I think I don't want to sound like Mr. Toxic Positivity. And I hope those of you who've listened to this podcast before know that, you know, I can get as frustrated as anybody else. I've dropped a few F-bombs on this podcast when things in the world are not awesome. And things are not awesome in a lot of different ways. But, you know, we do have an opportunity. We have an opportunity to respond in a way. And that opportunity does bring me some hope, because I think we have an opportunity to react and respond in a way that makes us better and that makes the people around us better. So if anything, sometimes adverse circumstances just make you rise up to the challenge. And that's what I'm going to try to do personally. And I'm hoping other people out there, and especially in the healthcare world, join us as well. It's too important. It's too important not to lean in.
That's my goal too, to look for those moments, those opportunities for kindness, to look for those moments for education and learning and connection and sharing information, and just trying to stay open-hearted, trying to stay soft.
And that's, Grace, I would just say that exactly what you said, no one can take that from you. Like, if you work to lean into kindness and grace and growing yourself as a person, no one can take that from you. That's eternally yours.
I agree completely. And that's what I hope for all of us. It's what I hope for all of our listeners. We hope you'll stay with us. Let us know, we might play with this episode's a little bit shorter, might play with format a little bit this year, might bring you some new topics. If you have any input in the podcast, you know where to find us on the listserv or how to get a hold of us. You can email our organization, and we'd love to hear more about your thoughts. info@cfha.net will come straight to us. So we're looking forward to being with you, to sharing information with you, to learning together this year. So thank you, all three of you, for being here. Monica, we missed you today. Thank you to our listeners, and we'll talk to you again next month.